Hello, my name is Angelica Lara Velasco, and I will be doing Chapter 8 on mental disorder. For myths and realities, for one of the myths, another myth is that the mentally ill are mostly violent, crazed, and therefore classified as dangerous. But in reality, about 90% of the mental patients are not prone to violence and criminality. They're actually more likely to hurt themselves rather than to hurt others. Um, and another myth is that in today's era, older people are more likely to suffer from depression rather than younger people. But in reality, over the last several decades, the problem of depression has increased so much among young people that today they're more likely to suffer from depression rather than older people. So there are many common misconceptions of the concept of mental disorder. One of the first misconceptions are that the mentally ill are believed to be extremely weird. A second popular belief is that the mentally illness is hopeless and incurable. Even after people are discharged from a hospital as recovered, they're likely to be viewed with suspicion. But in reality, about 70 to 80% of hospitalized mental patients can recover and live relatively normal lives if their treatment has been adequate and received in time. The third popular belief is that there is a clear distinction between mentally ill and mentally normal people, quote unquote. Um, so, most of the time, even a psychiatrist cannot clearly differentiate the vast majority of the mentally ill from the mentally healthy. The fourth popular belief is that the mentally ill are most crazed and violent, as often portrayed in news media, movies, and television programs. In fact, about 90% of mental patients are not prone to violence and criminality. The fifth popular belief is about midwinter depression. So, psychiatrists refer to this as an acronym which is SAD, which stands for Seasonal Affective Disorder. Many of people assume that we are likely to become depressed in the middle of the winter because of its coldness and the lack of sunshine. Although some researchers show patterns of winter depression, the official diagnostic manual used by psychiatrists only suggests that it might be a pattern caused by some other disorders. The sixth popular belief is that antidepressant drugs such as Prozac, Zoloft, Paxil, and Wellbutrin can cure depression. So, research has indeed shown that about 75% of the patients who take these drugs do recover from their depression, but it's not necessarily the drugs. It's instead the patient's belief that the drugs will cure them and get rid of their depressions. Last but not least, the seventh popular belief is that there is an epidemic of autism, which is characterized by serious problems with language and social bonding among American children. Many behavioral scientists would disagree. They point out that much of the starting rise in autism results from a broader definition that includes many more children with mild symptoms who would not be considered autistic in the past. So, for types of mental disorder, there are two opposing views that psychiatrists have on what constitutes mental disorder. One of the views is the medical view. The medical view defines mental disorder as a biologically caused disorder, just like a physical disease. The other view of mental disorder is the psychoanalytic view, which defines mental disorder primarily as an emotional problem that is a psychological problem in origin. So, for traditional classification, there is a traditional classification system that divides mental illness into two broad types, which is organic and functional disorders. Both types may show the same symptoms, such as hallucination, delusion, impaired judgment, and other behavioral disturbances, but they can be differentiated on the basis of their underlying causes. So, organic disorder is caused by damage to the brain, which in turn may be originated from a tumor, a head injury, viral meningitis, brain syphilis, lead poisoning, drug abuse, or other acute physical damages. On the other hand, functional disorder is believed to result from psychological and social factors such as unpleasant childhood experiences, impersonal conflict, or social stress. Functional disorder constitutes a much larger category of mental disorders than organic disorders. For functional disorder, it could be divided into three major categories, which is psychosis, neurosis, and personality disorder. For psychosis, it is more serious than neurosis and personality disorder. Neurosis is less severe than psychosis, and personal disorder is a general category for all sorts of mental disorders that the psychiatric cannot diagnose as either psychotic or neurotic. The DMS-5 classification is a different type of classification, and there is a much greater number of mental disorders. In fact, there's over 300. They can be found in the DMS-5 classification. So each specific mental disorder has a list of symptoms. Panic disorder, for example, is defined as having symptoms such as the following. So for panic disorder, a psychiatric would look for shortness of breath or smothering sensations, dizziness, trembling or shaking, sweating, choking, nausea and abdominal distress, chest pain or discomfort, and fear of dying. So checking a patient against lists of symptoms such as this, psychiatrists can determine what mental disorder their patient is suffering from.
Hi everyone, my name is Carmen. I will be speaking